Febrile seizures are convulsions or seizures that occur in young children in response to a high fever, often due to an infection. They are relatively common in children between the ages of 6 months and 5 years, with the majority occurring between 12 and 18 months. Febrile seizures are generally benign and do not usually indicate a more serious underlying condition. Types of febrile seizures: simple febrile seizures. Duration: typically last less than 15 minutes. Frequency: usually occur only once within a 24-hour period. Characteristics: involve generalized convulsions affecting the whole body. The child may lose consciousness, have stiff or jerky movements, and may appear unresponsive during the seizure. The child recovers quickly afterward. Complex febrile seizures. Duration: last longer than 15 minutes. Frequency: may occur more than once in a 24-hour period. Characteristics: can involve focal seizures affecting just one part of the body or have prolonged postictal confusion following the seizure. These may require further medical evaluation to rule out other conditions. Causes and risk factors: febrile seizures are typically triggered by a rapid increase in body temperature. The exact cause of febrile seizures is not completely understood, but some contributing factors include rapid rise in temperature. A quick increase in fever, even if the overall temperature is not extremely high, is more likely to trigger the seizure. Family history: the family history of febrile seizures may increase the risk. Genetic predisposition plays a role. Underlying infections: common infections such as ear infections, respiratory infections, or gastrointestinal infections can lead to fever and subsequently, febrile seizures. Symptoms during a febrile seizure: the child may exhibit loss of consciousness, the child may become unresponsive or lose awareness of their surroundings. Muscle stiffening or jerking movements: the child's arms and legs may stiffen or jerk rhythmically. Rapid eye movement: the child may have uncontrolled eye movements. Breathing changes: breathing may be irregular or momentarily halted. Postictal state: after the seizure, the child may be drowsy, confused, or irritable. Diagnosis: febrile seizures are usually diagnosed based on a medical history and the description of the seizure. The following may be considered. Medical history includes the child's previous febrile seizures and any family history of seizures. Physical examination, to assess the child's overall health and look for signs of infection. Blood tests may be done to identify any underlying infection or metabolic issues. Imaging studies: typically, these are not required unless the child has complex febrile seizures or other neurological symptoms. A CT scan or MRI might be used to rule out structural abnormalities if needed. Electroencephalogram (EEG) rarely used for simple febrile seizures but may be performed if the diagnosis is uncertain or if the child has complex symptoms. Treatment for most children with febrile seizures: no specific treatment is necessary once the seizure is over, and the focus is on managing the fever. Immediate care during a seizure: stay calm, ensure the child is in a safe environment. Protect from injury: place the child on a soft surface and keep them away from sharp objects. Time the seizure: if the seizure lasts more than 5 minutes, seek emergency medical help. Managing fever. Medications: over-the-counter medications such as acetaminophen, Tylenol or ibuprofen can help reduce fever. These should be used according to age and dosage guidelines. Cooling measures: dressing the child in light clothing and keeping them hydrated can help manage the fever. Long-term management. Antipyretics: regular use of fever-reducing medications during illness may be recommended to prevent high fever. Seizure medications: generally, these are not required for simple febrile seizures. However, if seizures are frequent, prolonged, or if there are complex features, the doctor might consider anti-seizure medications. Prognosis: febrile seizures are generally benign and have a good prognosis. Recurrence: about 30 to 50% of children with a febrile seizure will have another one. especially if the first occurs before 18 months of age. Developmental outcome. Most children with febrile seizures do not experience long-term developmental issues or epilepsy. Epilepsy risk. Children who have had febrile seizures are at slightly increased risk of developing epilepsy later, but the overall risk remains low. When to seek medical attention. You should seek medical attention if the seizure lasts longer than 5 minutes. Immediate emergency care is needed. The child has difficulty breathing. Post-seizure breathing difficulties require prompt evaluation. The child shows unusual symptoms, persistent drowsiness, vomiting, or signs of infection need medical assessment. Seizures are recurrent or complex. Multiple or unusual seizures may need further evaluation by a specialist. Conclusion: febrile seizures are a common response to high fever in young children and are typically benign. Most children recover fully with no long-term effects. Management focuses on fever control and ensuring the child's safety during a seizure. If febrile seizures are frequent or associated with other concerning symptoms, consultation with a healthcare provider is important for proper evaluation and management.